Hey guys, so I just left Hopkins a couple minutes ago. I have some good news and some bad news. Not like really bad news because obviously I'm not still there, but anyway, so I completed the Home Spirometry Study today. It was my last visit, and the reason I had come in early instead of just completing it at my clinic visit next week is because my numbers are really down right now. And it's not because I'm getting sick. That's the good news. It's really honestly because of the cold weather, and my doctor came to that conclusion with me today because I don't feel bad. I'm not like overly tired. You know, I'm not really junky in my lungs. I'm junky, but I'm at my baseline, meaning there's no extra, I'm not coughing up a bunch of extra crap than what I normally would for a CF patient or for me personally. And so that's the good news. But the bad news is that even though I blew 2.6 liters, my percentage, my FEV1 percentage, which is like your initial, how much air you blew out initially in that first second, is down to 80%, and my baseline is 95 to 100%, and that's like phenomenal for a CF patient, and I like to keep it that way, but right now it's just not. And 80% is a big difference, and so I just need to be really really proactive in getting all my treatments in and just try to make sure that I don't end up getting any lower, because any lower I'm going to have to like fix it with IVs. There's just no ifs, ands, or buts about it. And even though I might not be sick per se. So I have clinic next week to get a full report and kind of see where I'm at. My weight today was 101.5, which is awesome. I'm in triple digits. Yay, that's good for me. So the other good news is, so I completed this study and I enrolled in another one. So the next study that I do is a really short study. It's just an interview. It's an interview to deal with pain and cystic fibrosis. So they're kind of want to hear our story about what kind of pain we live with, what kind of pain we deal with every day, and if it's related to CF or if it's something really completely different and it affects living with CF as well. And we all know my pain issues, well, most of us do, and so I have a lot to tell when it comes to that, and that's going to be really good for them to get an idea of what somebody with CF lives with. They're going to be interviewing adults now, so I'll be one of those adults. I'm excited to tell them, as if they don't already know, you know, what my story is and what kind of pain I deal with and what kind of pain I might deal with that I don't necessarily complain to them about, because there's really just nothing they can do for some things. And there's actually 2 other studies right now that are active, that are in the pipeline, that I'll probably be enrolling in. I'll probably do one of them first and then the other one, because I can't be in 2 studies at once. And just to touch on doing CF research studies, I like to do them. I like to make a difference in my CF community in any way possible. I've been doing them since I was a kid, and I swear they have my number on speed dial because they find me everywhere, and that's okay with me because I want them to. I tell them, you know, call me when something comes up, because if I can do it, I'm going to. I really feel like a lot of CF patients need to become more proactive in helping with research studies, and because we are the reason that all these new treatments and new ideas come about. You know, they want to know, it takes a CF patient, it takes volunteers to get a cure, you know. There's a quote in Hopkins, and I might misquote it just a little bit, but behind every good treatment or cure, there is an extraordinary group of volunteers, and that is very important in treating any disease or ailment in this world. And I really think it's important for CF patients to get proactive in their community. I am, and I really hope I can encourage other CF patients to become more proactive than what they either are or if they're not. So anyway, that's what I just kind of wanted to touch base on, and I will probably post an update next week when I have CF clinic. So see you bye-bye till then.